Dr. Torres, I'll start with you and this new guidance from the CDC, which scales back the guidance on getting tested if you have no symptoms. Is that even if you think you've been exposed, if you don't have symptoms, they're saying don't get a test?
And good morning, Savannah. And that's exactly what they're saying. They're not saying if you don't have symptoms. They're saying if you've been exposed and you don't have symptoms, then don't get tested at this point. Only get tested if you've had symptoms or you're what they call part of the vulnerable population.
Does that make
and
sense?
Your doctor thinks you need a test. Yeah, it's a big concern, and there's a lot of consternation in the public health community because we know that the three important points of getting the pandemic under control are testing, isolating, and contact tracing. And now we're taking one of those legs and we're shortening it a bit and saying you only need to be tested if you have symptoms. The problem is we know that around 40% of people with COVID-19 don't have symptoms. They could be silent spreaders. And so we're not really looking at those people who still could be spreading it around. It's going to be a little tougher to keep this under control. What public health experts are saying, in the meanwhile, as we're getting all this sorted out, if you've been exposed, quarantine yourself for 14 days. If you get symptoms, go ahead and get tested. But like I said, this is causing a lot of consternation in the medical, the public health community, a lot of head scratching, trying to figure out exactly why this is happening, why we're doing this, because testing should be one of the tools we use, and it should be ramped up as time goes on here. We have gotten more tests. We need more tests now, too.
Yeah, okay. The FDA actually just authorized a new antigen test. How does this work? How is it different than what's already out there?
And this is good news, and hopefully it helps out a lot, get this under control. If you've ever gone to the doctor and you've gotten a rapid flu test or a rapid strep test, this is going to be the same thing. So instead of sending it to the lab, the doctor's doing it in the office. It's a simple card. They'll take a nasal swab. They'll process that card. It takes 15 minutes. And then they'll come back in the room and say, you have it or you don't have it. It's not as accurate as the ones you send away because those take days to process in more complicated laboratory situations. But it can be a screening tool. And usually as doctors, what we look at this and we say, if it's positive, then you definitely have coronavirus. If it's negative, but you still have symptoms or we're concerned, let's get one of those more accurate tests to find out. But Abbott, who's the company making it, is saying they'll have tens of millions of these tests in September, 50 million by October. They're actually putting an app out that you can put on your cell phone. So if you get a positive on this or a negative, you can take it to your work or your school and you can say, here's my test results. I just got them back today. And that way they know what's happening with you and whether you have it or not and what they need to do with you at that point.
Right, exactly. Well, if you're positive, stay home. Send a screen grab. Okay, Dr. Torres.